The U.S. is bracing for a potential third peak of the coronavirus, with case counts climbing in 38 states. Globally, we have seen the number of infections now reaching 40 million. Let's bring in Dr. Adrian Burrowes. He is a family medicine physician and the CEO of CFP Physicians Group. He is joining us from just outside of Orlando today. And Dr. Burrowes, it's good to talk to you, although certainly not under good circumstances in Florida. We saw over the weekend Florida reporting its highest number of cases in 2 months, more than 4,000 cases in a single day. What's contributing to that uptick?
So thank you for having me on. So Florida had done a fairly good job of trying to control coronavirus by, initiating some lockdowns and, really pressing hard to promote social distancing and mask wearing. Well, then now the governor has opened up bars, opened up nightclubs. He's allowing stadiums to operate at full capacity, which thankfully the stadium owners haven't done as of yet. But I think that being very lax in terms of the treatment of the population here in Florida is lending towards this growth of the coronavirus in our state again. That coupled with it being now the fall, when we start seeing a lot more of the viruses that we ordinarily would see around this time period. And coronavirus likely being more potent in colder weathers. I think that's why you're seeing this uptick now.
Yeah, doctor, it feels like we have seen this story before. Several months ago, we were talking about Governor DeSantis lifting those restrictions. We saw the uptick and then the restrictions come back down again. And yet we heard from Dr. Fauci yesterday, speaking to 60 Minutes, saying he doesn't see another economic shutdown is just possible, saying there's too much fatigue right now around the virus. As a doctor who's having to handle this, what do you see as the realistic measures to try and control the spread right now?
So, yes, I think that what we need to be really focusing on now is doing what science tells us is the right thing to do. And science has told us that wearing a mask is the right thing to do. For all you anti-mask wearers, it's the right thing to do. To social distance, that's the right thing to do. To continue the hand washing and continuing the things that we know help diminish the spread of the virus. And I think that people have developed a lot of COVID fatigue. It certainly is out there. And I think that the lack of political support when we have science that has shown us what the right thing to do is what the issue is. So I'm asking all the viewers to, kind of stick with science, stick with people like Dr. Fauci, and try to ignore all the political rhetoric that has now poured itself into what is a public health issue and has become more and more a political issue.
And doctor, we've heard from a number of our guests who have come on to say, look, there are concerns around the uptick in the virus, but this time around, given what has been learned over the last several months, doctors are better equipped to handle the surge. What are you seeing on the ground there, and do you agree?
So I do think that having, had some experience now with dealing with COVID-19 from earlier part of this year has allowed a lot of the hospital systems to ready themselves for what will definitely be an uptick coming up as we have another wave of COVID-19. The hospitals here locally where I am, actually have traveling nurses prepared and ready for any potential uptick, and we've had a lot more supplies come in as of late. So those are the things that we were battling against before. We really were not prepared. We didn't have the supplies that we had necessary, and now I think we've seen a lot more of that. That being said, I think that we're going to see a significant rise going forward. So hopefully the public helps us by doing the proper things.
Let's talk about what the election risk is in the context of COVID. You have seen those long lines around the country in states that have already started their early voting. Florida also today, I believe, first day of early voting in the state there. What are you telling some of your patients who are concerned about whether they should in fact go out to vote? Is there potential for some of these polling sites to become spreader events, or are you comfortable with the kind of measures that have been taken place in order to allow for people to vote in person?
Well, I think it depends on the polling site. I've seen some polling sites that have clear delineations of 6 feet distance between people in line. I've seen, them being really conscious of the people that they're allowing in, how many people they're allowing into the polling sites. And then I've seen some others that look like complete disasters. And I think that if people have that concern, they really need to call their polling places and see exactly what it's like. You can certainly look and see what the polling places look like. I understand why the people have a concern. Mail-in is still an option for many people. But I think for the people that really want to go in and vote, just make sure that you do your best to socially distance. And if you're not seeing it, then speak to the people around you and let them know that that's what you'd like to see around you as an individual, to spread themselves out around you.
Yeah, well, it's certainly been comforting to see some of these images coming out from those who are in fact staying distance as they wait in those long lines voting. Let me ask you this, because we've been talking a lot about the stimulus negotiations in Washington, and a lot of the discussion has been around the testing program and contact tracing. And you've heard Nancy Pelosi, the House Speaker, talk about making sure that there is a comprehensive approach from the federal level, and some of the disagreements are on the language of that. How comfortable are you in the system that's in place right now? Is there enough testing? If you're talking about the state of Florida, is there enough contact tracing being done?
So I think that there is not enough being done. I think that, in order for us to truly combat COVID-19 the way that we need to, the federal government needs to make clear rules and policies regarding how we deal with this virus. And as of yet, that has not occurred. We need guidance as a population from our federal government to tell us how to combat the virus, to follow the science behind the contact tracing and the testing protocols. And I think that once we start doing that, then we'll really try to decrease our cases of coronavirus. At our level, we should not be doing this poorly.
Certainly, a lot of people would agree with that, especially given the uptick that we have seen in the state of Florida and other states across the country. Dr. Adrian Burrowes, it's good to talk to you. Appreciate your time.
Thank you so much.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.